coming back to the issue of generics versus patents, there's obviously the system isn't working as efficiently as it might do. What is the way forward? What's been suggested as a way of getting more research done, more medicines through the system?
I think there are sort of 3 or 4 problems. There's a problem generally about the level of new medicines coming through the system, even in the industrialized world. And so the number of new medicine approval applications has slowed down pretty dramatically over the past decade. And I'm not sure any of us know quite why that's been. There are various theories. So clearly the patent regime may have a part to play in tweaking that. You know, if we could shift the patent regime around a bit, you might provide better incentives for more radical innovation. There's also a complaint that too many...
Shifted around, just very quickly, shifted around how?
It's above my pay grade, really, but I mean, some of the ideas that are discussed are to say that you would give stronger and longer patent protection for more dramatic discoveries. So in other words, if you came up with a slightly better formulation of the medicines to treat... medicines we have now to treat high cholesterol are pretty good.
Yeah.
We don't really have a vast medical need.
Yeah.
So any new medicines that come along are going to be gradual incremental improvements on what we have now. You might give fewer rewards for that than you would give, for example, for coming up with a new class of antibiotics. You know, we have very few new antibiotics in the pipeline, quite frightening prospect, and it's difficult to make money off antibiotics. You know, people take antibiotics for a couple of weeks and then they feel better. They are better, in fact, they don't feel better. So it's actually very tough to make money out of an antibiotic. So there have been suggestions that you could adjust the patent system in Europe and North America to give different kinds of rewards for different kinds of progress. You know, you might give a longer and stronger patent on new antibiotics than you give on... But it's difficult, and it involves subjective judgments. I mean, if it's you who has high cholesterol and you find the side effects of the current medicines unacceptable, you might not agree with the subjective judgment that it's more important to have new antibiotics. So I mean, there are problems with that. But that's
difficult political discussions.
Yeah, difficult discussion. So that's one issue. The second issue then is how do you make medicines affordable to every country? And I think there are very radical proposals for adjusting the patent system there. As I've said to you, I mean, there are people who say it shouldn't apply at all effectively outside the richest...
Médecins Sans Frontières has a very particular proposal.
Even Oxfam would probably say something like that.
Yes.
I'm not quite sure I understand fully their proposals, but I think they'd probably say something like that. That's a very dangerous step that we would all, I think, have to think about. And so MSF believes that it can replace the current patent system effectively with a system of prize funds. And I don't think this has been considered nearly seriously enough, because it's a prospect that worries me a great deal. The third possibility is we come up with some kind of so-called tiered pricing system. So we say we're not doing away with intellectual property, but we are going to have some kind of international agreement that holds in most circumstances for most countries. You know, these systems are never perfect, but which roughly ties the price of new medicines, so not the ones that are accessible to generics, but the price of new medicines to a country's ability to pay, to its per capita GDP. And that we would have a system where medicines roughly went up in steps according to the ability of countries to pay. Clearly getting an international agreement on that would be very tough, but there are some people who think
this may be a solution.
It might be possible, and we have something like it in vaccines, something like it. So it's sort of feasible. I mean, there are all kinds of difficulties in getting the agreement, enforcing it, stopping people shipping medicines back and forth. But it's probably more viable than the current system. I mean, under the current system, we effectively expect a country like Bulgaria to pay far, far more for its medicines than a country in a similar economic situation but in a different part of the world. And I don't think that's sustainable over the long term.
Mark, thanks for talking to me today.